So now we're going to talk about the second stage of birth. We're going to talk about the pushing phase, okay? So as I mentioned in the previous video, baby's head starts to come down through the cervix, come down through the pelvic floor, and start to come down through the vagina, okay? So what I said before in the previous video is about baby's head. So we know babies have got 2 soft spots on their head, and they allow the bones of baby's head to gently overlap, so the baby's head actually gets smaller while you're pushing and while you're giving birth. Does that make you feel more reassured? Because it would reassure me to know that my baby's head's actually going to get smaller as I'm giving birth, because some women are worried about the size of that and how is the baby's head going to come out. Nature's very clever, okay? And the baby's head will get smaller. So what happens then is the contractions generally now start to space out again a little bit, but they start to last longer, okay? So you're having less contractions, but each contraction is lasting longer to facilitate you to be able to push, okay? So what's happening then, as baby's head is starting to come down through the cervix, down through the vagina, you'll start to feel pressure in your back passage, okay? And that pressure usually comes because baby's head is pressing down onto the internal part of your bottom, okay? So a lot of ladies, the first signs that they know before they've even been offered a vaginal examination or before they even kind of know about the transition phase, they start to feel like they want to have a poo. Okay? Now, having a poo can be quite a scary thing when you are in the middle of having a baby and you're in front of a midwife that you've only met maybe a few hours previously and you're in front of your birth partner. So having a poo in front of these people is not something that you would normally do. And often having a bowel movement, having a poo is a private thing that you do in your bathroom on your own, okay? So a lot of women, when they feel that pressure in their back passage, get really worried that they're going to poo themselves in front of these people, okay? And that can actually hold them back. So they think, I don't want to push because I'm really worried about having a poo, okay? Please be reassured that if you do poo at all during the labour phase and you're in the pushing phase, we are very discreet, okay? You'll not know that it's happened. We'll very discreetly move it away. And often you'll find even in the run-up to labour that sometimes you do have some loose bowel movements anyway. You find you get the runs for a couple of days before you go into labour. And I like to think that's nature's way of kind of clearing everything out for you to let you release some of that anxiety, because you understand actually that you've been to the toilet more than you normally would do, so everything's been cleared away, okay? Also, it's reassuring to know, I think, that actually as baby's starting to come down, because of the way that the vagina is placed in your body, it's right next to the back passage. So as baby starts to come down lower, it actually flattens the back passage off. So as you're pushing, the exit, this is a very poo-centric conversation, I apologise. Any poo that's actually lingering higher up in your body can't come down, okay? Because the exit is sealed off by the weight of baby's head closing everything off, okay? So it's unlikely that you would do any bowel movements, and if you do, it'll be a tiny, very small amount, just from any residue that's left in the small bowel when you've last had a bowel movement. Okay, so again, people ask me a lot, how long does it take to push? Okay, and you might have heard stories from family and friends about this, but generally, for a first baby, we say about an hour or 2. Okay, can be more, can be less, depends on lots of different factors. But generally, if you're getting that urge to push, you feel like you want to have a poo, we encourage you to go with that. Okay, and if after maybe half an hour or so of you pushing and having that really primal urge to bear down and push your baby, if we can't see any progress, if we can't see signs that baby's starting to get lower, we may offer to do another vaginal examination and just find out exactly where baby is, how far baby's come down, and maybe encourage you to change positions or something like that to help you with this stage of the birthing process, okay? So it's really important that you follow your instincts and you get into whatever position it is that you feel more comfortable, okay? We know from a nature perspective that actually positions that allow your pelvis to open, so positions where you're like on all fours or on your side, any position that basically avoids you being laid flat on your back is likely going to make this phase of labour quicker, which everyone wants it to be quicker, can often make it quicker and more straightforward, okay? So ideally, we'd like you to be in a more upright position, but just get into whatever position feels normal and whatever position feels the most comfortable at this time, okay? So the baby's head obviously is making its way down the vagina at this point. You're still getting that pressure, you're having that urge to push, and the pushing feeling is like a reflex. It's like a cough or a sneeze. You can't hold it back. If someone gave you £1 million, you wouldn't generally be able to stop that feeling because it's the gentle pressure of the contractions coming from the top and baby's head's just coming and coming and coming, and you're pushing because you're getting that, the baby's head is triggering that response in your body, okay? So the baby's head starts to come down. So if you're in a nice upright position, I'll show you this way. If you're in a nice upright position, you can see it's a lot easier as baby's head is coming down and round. It's a lot easier for baby to make the progress because there's lots of space here, okay? So none of the areas of the pelvis are restricted. The mum's legs are open, she's able to move around, and she's able to move around in a way that feels natural for her to allow her baby to come through, okay? If you are in a more laid back position, so if you're laid flat on your back on the bed, what actually happens is that restricts the movement of the major areas of the pelvis to actually make the outlet, the part of the pelvis that the baby is now coming through, narrower, okay? So it restricts the movement of this tailbone. So as baby's trying to come through, and the way that you're laid on the bed is the pelvis is now narrower, so you're having to push and work a lot harder to get baby through because it's a lot smaller space. Okay, so you can see on the other side, as I just mentioned before, if you're on all fours or you're on your side and you're able to allow that bone to flex out of the way, it's a lot easier for baby to navigate its way down and for your effort to have a lot more result because your baby will be with us a lot faster, okay? So it's really important that as baby's head starts to come through, that you're listening to your midwife and you're following your instincts, okay? So there'll be a phase of the birth as the baby's head starts to crown, okay? And crowning is just a fancy way of saying that the baby's head is being born, okay? So if this is your vagina, you're pushing and we can see the baby's head starts to appear and then it goes back in again, and that's normal, okay? We want the tissues or the structures of your perineum and your pelvic floor to stretch very gently, okay? If this is your first baby, your perineum has never stretched before to accommodate the size of baby's head. So when you're breathing, as I mentioned in a previous video, you need to be breathing to send all the oxygen down to your womb for the work that it needs to do, but also you need to be sending the oxygen down below to allow it to stretch, because we know tissues that are white are very rigid. So if they're very rigid, they've not got a lot of oxygen there, okay? So if tissues down below are red and they're stretchy, we know there's got enough oxygen and enough blood there and they're gonna stretch a lot more easily. So it's very important then, as you're feeling baby's head starting to rock back and forth, you may feel that it starts to sting, okay? And that's normal. It's just a result of the widest part of baby's head now starting to emerge and be born, okay? Women have often one of two reactions to this phase of birth because it does sting, it's quite uncomfortable. Some women want to push really firmly and get rid of that feeling because it's not a very nice feeling, or women are reluctant to kind of go with it and just don't want to push at all, okay? So as we know that the contractions will keep coming and you will still keep getting that urge to push, so if you can't stop the pushing, it's best that you go with it, okay? And you just allow your body to keep gently nudging baby out. The midwife caring for you will be speaking to you, she'll be guiding you, she'll be telling you what's happening if that's what you want her to do. She'll say, I can see baby's head now, the baby's head's going to start to be born, and she may put some gentle counter pressure there against the baby's head just to stop the head from being born too quickly, and also maybe put a bit of pressure on the area between your vagina and your back passage, so that the perineal area, put some gentle protection there as well to prevent the baby's head from being born too quickly, to reduce the risk of tearing, okay? And we call that manual perineal protection, okay? And your midwife will speak to you about that when you're in labour, or when you're in your community midwife might speak to you about it as well. So the baby's head is born, it's the widest part, so when you feel the sting, you just need to remember that it's just the widest part of baby's head being born, and the best thing you can do is just to breathe, okay? And as you breathe deeply, you're going to send all the oxygen down below to allow those tissues to stretch that little bit extra way to make the maximum space for baby to reduce your risk of tearing, okay? So the baby's head will be born, might feel quite uncomfortable, but then it usually feels quite a lot of relief because you've kind of done the hard work with the baby's head. The shoulders usually follow quite easily after that. So the baby's head is born, and then something happens called restitution, and that's just a fancy way of saying the baby's head turns, okay? So the baby's head's out, it's born, the baby's head will gently turn, and that allows the shoulder on the inside, as it's coming down through the pelvis. As the baby turns its little head, it allows the shoulder to be free, okay, and to come down through under the pelvic bone. And babies are usually born looking down because they've done like a little corkscrew turn as they come down through the pelvis. So they're usually born with their head looking downwards, okay? And usually after the head's been out a little while, the next contraction will come. The midwife will encourage you to give another push, and then you'll have your baby. Just as simple as that. So then you'll have your baby. The midwife might then offer to check your perineum to see if there has been any tearing, okay? Most women, when it's their first baby, will have some sort of tear, okay? Maybe it's just like a little tiny bit to the skin that doesn't need any stitches, it's not bleeding, it looks to be healthy and it will heal nicely. If there is a tear that involves more muscles in the back passage even, or muscles of the vagina, the midwife might offer to put you some local anaesthetic there, like when you go to the dentist. So numb the area and put you some stitches in just to make sure the edges come together on the tear and to promote the best healing, okay? And that's it for the pushing phase.